Welcome to this medicine masterclass on hypothyroidism. Hypothyroidism is a clinical effect resulting from the lack of thyroid hormone. This results in a reflex increase in thyroid stimulating hormone and low levels of T3 and T4. Patients may appear tired, sleepy, lethargic, intolerant to cold, complain of weight gain, menorrhagia, and may develop a hoarse voice. There are several signs that can be picked up. They may be bradycardic, the reflexes may be delayed, they may complain of ataxia, dry skin, they may appear drowsy or lethargic, the hands may be cold and they would try to heat themselves up with extra clothing. They may have fluid buildup through ascites or edema. They may have a round puffy face with coarse features, appearing depressed. They may complain of symptoms related to ileus due to slowed gastric transit, as well as congestive heart failure or the presence of a goiter. Neurological signs include delayed deep tendon reflexes, and this is known as Waltman sign. They may complain of carpal tunnel syndrome, peripheral neuropathies, and in extremis may have a myxedema coma where patients present with severe bradycardia, profound hypothermia, and comatose. The lack of thyroxine may also impair the cognition of the patient, leading to pseudo-dementia, and they may develop deafness to higher tones, known as Trotter syndrome. In babies, they may have Pendred syndrome, which is babies born with a goiter and mental retardation and deafness in constellation with hypothyroidism. The causes of hypothyroidism include goiters. This can be as a result of chronic thyroiditis or iodine deficiency, or drug-induced as a consequence of amiodarone, lithium, or aspirin. Non-goiter causes include atrophic thyroiditis, post-thyroidectomy or radioiodine treatment, or congenital maldevelopment. The pituitary gland, which stimulates the thyroid gland, if it's damaged as a result of panhypopituitarism, can also result in this condition, as well as isolated TSH deficiency. A neoplasm of the hypothalamus or an infiltrative process affecting the hypothalamus can also result in hypothyroidism. The management is simple. It's to replace the thyroxine that's lost, and this is usually uptitrated through the endocrinologist and the general practitioner regularly reviewing the patient. Occasionally, a patient may have subclinical hypothyroidism. This is where the TSH is raised, but there are normal concentrations of free thyroid hormones. Such patients need to be monitored carefully and investigated for other conditions such as anti-thyroid antibodies, and if required, patients may require treatment if the disease progresses. Thank you for attending this medicine masterclass.